Hello, everyone, and welcome to our 34th Global Public Seminar in Comparative and International Education. I'm Maya Changseliani. I'm Associate Professor of Comparative International Education here at Oxford. Before introducing our speaker, I would like to attend to a few administrative points. This webinar, as you might have noticed, is recorded, and we will post it online on the Department of Education YouTube channel in due course. As we listen to our speaker, please keep yourself muted and put your comments or questions in the chat. On the right-hand side, you will see the chat function, so put any comments or just put there that you wish to speak, and I will invite you when the presentation is over. When I invite you, please unmute yourself, turn on your video if you would like to turn it on, and state your name and where you are from before sharing your question or comment. I'm delighted to host today our speaker, Dr. Asmaa Al-Fadala, who is Assistant Professor at Hamad bin Khalifa University's College of Public Policy. Asmaa brings 28 years of experience in K-12 and higher education, as well as policy development. Over the course of her career, she has served as a government policy writer, as a professor, author on leadership reform, and educational board member. Asmaa's research focuses on leadership for learning, educational transformation, entrepreneurship, teacher development, innovation in education, and sustainable development goals. Dr. Al-Fadala earned her PhD and MPhil in Education Leadership and Policy from the University of Cambridge. She advises global organizations and serves on several advisory committees, including the Hughes Hall Development Strategy Group. Hughes Hall is one of the constituent colleges of the University of Cambridge. She's also a board member for institutions such as the University of Doha for Science and Technology and the International Congress for School Effectiveness and Improvement. Today's talk is titled Action Plan for an Inclusive Education Policy for the State of Qatar. The floor is yours, Asmaa, if you wanted to share your presentation slides.
Thank you, Maya, for inviting me, and hello, everyone. I can't see you now, but hopefully later after my presentation to have the opportunity to discuss with you this important report. So as you can see from the title, I'm presenting a report on Action Plan for an Inclusive Education Policy for the State of Qatar. This report is the result of an extensive research conducted by myself and my colleagues in partnership with Professor Nidhi Singhal at the Cambridge Network for Disability and Education Research at the University of Cambridge. This report provides a roadmap for enhancing inclusion of persons with disabilities in both education and employment, as I mentioned, in Qatar. And it is significant because it is the first comprehensive study of its kind in Qatar. Our aim from this study is to bridge the gap between existing policies and effective implementation on the ground. This is an overview of this report. Talking about the context and background, I'll not cover this because I want to spend more time on data and methodology. Qatar has demonstrated a strong commitment to supporting people with disabilities, as evidenced by its adoption of many international initiatives like Education for All and the UN Convention on the Rights of Persons with Disabilities. Also, Qatar has taken legal steps to protect the rights of individuals with disabilities, such as Law Number 2 of 2004. However, as you know, like many initiatives and strategies, translating this commitment into consistent, impactful action requires addressing the gaps between policy and implementation. That's why we conducted this research to dive into these challenges and most importantly, to suggest concrete steps forward. One of the key issues is the variability in inclusive education models across Qatar. What do I mean by this? Some students placed in mainstream classrooms, while others are in more specialized settings, and that created a lot of issues. I'll talk about it later on. This inconsistency underscores the need for a more an equitable approach. Also, there is a lack of awareness among school staff and employers regarding inclusive practices, highlighting the need for more training, awareness raising initiatives, and so on. So this is in summary why we started this study. And in fact, during COVID-19, we did a study looking at the voice of parents and teachers in responding to COVID and online learning in Qatar. Then we thought we need a roadmap and to help not only policymakers, but also practitioners to suggest practical steps for better implementation. Moving to the next slide, research approach. So to develop an actionable approach, we conducted our research in 3 phases. And this really took a lot of our time. I think it's unique because we involved different stakeholders at different stages. Phase number 1, where we involved comparative, critical policy analysis, examining policies in Qatar, Jordan, and the United Arab Emirates. Of course, we chose these countries due to their comparable social, cultural context and the availability of policy documents in English. I presented this report last week in our college, and someone suggested, why not Saudi Arabia or Bahrain? Of course, we can look at other countries, but because of the scope of our project. Phase 2, where we engage directly with key informants representing a cross-section of stakeholders in Qatar. In fact, we did this phase after the policy analysis, after the literature review, where we invited different stakeholders in a roundtable discussion, bringing together over 50 participants, including disability rights advocates, educators, researchers, policymakers, to discuss barriers and potential solutions. And it wasn't only a phase for data collection, but Qatar is small. We want to engage them and raise awareness of this report at early stage of our study. We then conducted in-depth, semi-structured interviews with 16 key informants to gain deeper insights into the perspectives and experiences. Finally, phase 3, after collecting our initial findings, we focus on generating collective action. At that time, I was at WISE, and during the summit, the World Innovation Summit for Education in Doha, instead of presenting our finding, we presented to audience of different participants, of course, researchers and other stakeholders, where we facilitated an interactive session where participants shared their reflections and contributed to developing an action plan. And most of these people who came to the first roundtable and we did some interviews, we invited them to more reflective process. The next slide showed the 3 phases in more in a graph format. As I said, critical comparative policy analysis, data collection from key informants and analysis, then generating collective action. Also, later on, when I talk about the findings, also there is a more methodological contribution here where we came up with specific themes came from data. Moving to findings, we divide it, or we're sharing it in different format. In terms of policy analysis, what did we find from the policy analysis? As I mentioned earlier, Qatar has demonstrated commitment to supporting people with disabilities and recognizing inclusion as a priority. Either in the Education for All initiative and the UN Sustainable Development Goal 4.31. Also, Qatar ratified the UN Convention on the Rights of Persons with Disabilities in 2008 and 2015. Also, we have legal and policy framework is already in place. Example, just briefly here, Qatar National Vision 2030, as I mentioned, law number 2 of 2004. Also, we have National Autism Plan 2017-2021, not only covering the medical aspect of it, but also the education part. In fact, at WISE, we did also a study looking at how we implement this from education perspective. And so on. But as I said, challenges remain in policy implementation. And this is one of the main reasons we conducted this research. Application of these policies is inconsistent, resulting in a range of inclusion models. A more standardized approach is needed, more cohesive and more equitable access for all. Policies should be more comprehensive, accounting for the diversity of disability types and needs. Also, wider dissemination of policies and awareness raising among educators and employers and the public are crucial to facilitate effective implementation. Addressing policy gaps is also key to achieving meaningful inclusion. Number one, policies must be implemented consistently and effectively. A broader understanding of disability and individuals' needs is required. As we found from the interviews, the meaning and the concept of inclusion varies from educators to policymakers, and this has implication on implementation. Collaboration among government bodies, educational institutions, and employers is essential. And of course, greater awareness and commitment to inclusive practices are needed across all sectors of society. So this is for the policy landscape analysis. Again, here I'm sharing findings and what needs to be done. But also for the comparative insights, we looked at policies in Jordan and UAE and identified valuable lessons and innovative practices that Qatar can learn from. Jordan has made significant strides in community-based rehabilitation, which emphasize integrating individuals with disabilities into their community. On the other hand, the UAE has developed comprehensive vocational training programs equipping individuals with the skills needed for employment. Again, these are just two examples. In the report, you can find more lessons for Qatar. I'm sharing here themes also that emerge from the comparison. And again, I found that this is really important when comparing different contexts, different countries to come up with these themes to help us for the interview questions and also to propose policies or steps to implement these policies in Qatar. So this came from the analysis of the policies in the three countries: awareness, empowerment, and policy implementation, to help us do the analysis and to use it as a lens to understand what needs to be done in Qatar in this context. Also here, findings through our engagement with the stakeholders, we identified several critical areas that need attention. There is a strong consensus on the need for increased collaboration between different sectors, improved teacher training, and increased public awareness about disability rights and capabilities. Stakeholders also emphasize the importance of more inclusive infrastructure and the integration of technology within educational institutions. So, for example, when we interviewed teachers, yes, they have a lesson plan, but there are lack of teacher training. Especially, we are talking here at different types of disabilities, learning disabilities, and visible and non-visible, physical disabilities, autism also. We have specialized schools here in Qatar, and they are really successful, but accessibility is not available for all. The next slide, we also sharing here stakeholder perspective, systemic issues and challenges. Our research reveals a number of systemic challenges that need to be addressed for inclusive education to take place in Qatar. Number one, a significant issue is the prevailing focus on visible disability. I'm quoting here as one educator pointed out, much of inclusive practices and initiative in Qatar focus on visible and physical disabilities rather than invisible ones. So focusing, for example, on wheelchair, accessibility, and so on. Although these are still need to fix. I was a few weeks ago in a board in one of the school, and we were discussing providing accessibility to different floors for students. So it is still an issue. This limited understanding often leads to the needs of individuals with less visible disabilities being overlooked. Another challenge is the lack of alternative academic tracks, particularly for vocational training. So the objective of this study, it's a roadmap or action plan for students here, not only their education, but their employment, which is really a challenging. This limits the opportunities for students with disabilities who may not thrive in traditional academic settings. And we found this even in the study I mentioned earlier during COVID. It was really hard to for blind or deaf students to learn through online learning. Autistic children the same, and so on. So these opportunities limits the opportunity for all the disabilities. Additional points here: the administrative structure in Qatar, characterized by silos and overlapping mandates, it creates confusion and hinders effective policy implementation. And again, this is, we found it in previous studies, either the autism study or during COVID. Although Qatar is very small, but we found silos and overlapping mandates, even when we launched our report last week, many people were not aware of all these initiatives. Again, part of the methodology that I shared earlier, that we want to engage different stakeholders and to be aware of this. And I consider this just a phase one, because there are a lot of steps that need to be taken to have better and effective implementation. A lack of comprehensive engagement and an unified effort from all stakeholders remains a significant barriers. So these are the findings in a quick way about the policy analysis and also the interviews. But we also put effort in mapping the way forward through a framework that Nidhi came up with in one of her previous study with WISE in 2017. And we use this framework for the reflective session at WISE around three R's: rights, resources, and research. I'll cover this really quickly here. So the report highlights the need for Qatar, as I said, to move beyond policy adoption to effective implementation to create more inclusive educational system. And here we are focusing, as I said, on the three R's: rights, resources, and research, as a roadmap for systemic reforms. Rights emphasizes on the right of all children, including those with disabilities, to access quality education that foster meaningful learning and skill development. The focus should shift from simply providing access to ensure active engagement, active participation, and the achievement of learning outcomes. This includes recognizing the right of people with disabilities to full social integration, not just accommodation in separate settings. Again, we found also this relevant to the study we did during COVID-19. And yes, there were lessons and infrastructure, digital infrastructure available for students with disabilities, but the engagement part was missing. The social aspect of learning was missing. The resources covering financial resources, human resources, technological resources to ensure access to assistive technologies, for example, to empower students with disabilities to participate more fully in learning and prepare them for future employment. And the final R is the research. This calls for rigorous data collection and research to understand the specific needs and challenges faced by people with disabilities in Qatar. Evidence-based insights should inform the development and implementation of inclusive policies and programs. Especially Qatar is hosting the Global Disability Summit in 2028. That's why we are working closely with different ministries, especially the Ministry of Family and Social Development. In fact, the minister, she wrote the forward, and they are we are working with them, hopefully to support the implementation. Moving into the recommendation, we divided the recommendation in different parts. The first one for policy and practice. Based on our findings, we propose several strategies that Qatar can work on to advance this agenda. And also, these are applicable for neighboring country, you know, Oman, Bahrain, Saudi Arabia, and in the Arab region, and also other countries to learn because what we are proposing, not only, as I said, not only for education, but employment, but is a framework for different stakeholders to work collaboratively and collectively to have better implementation. So for the recommendation here, number one, we need policy harmonization. This involves developing a unified national policy, inclusive education and employment that aligns with international standards and best practices. Such policy would provide a clear and consistent framework, ensuring that all students with disabilities have access to quality education. Because what we have initiatives, we have programs here and there, but it's not a roadmap that the whole country can follow and you know, to avoid duplication and so on. Especially this type of education and employment involves medical institutions, Ministry of Labor, K-12, higher education, workplace, ministries, and so on, private sector as well. Second, capacity building is so important. We need to invest in training and professional development programs for educators and practitioners. I think this is relevant to all areas in education, but this is so complicated and complex because of the diversity of different, even with autism, that we have different types of autism, learning disabilities, and so on. So we need to train and provide and invest in professional development. This type of training should equip teachers and educators with the necessary skills and knowledge to effectively support inclusive education, including understanding diverse learning needs, implementing individualized education plans, and creating inclusive classroom environments. Third, public awareness campaigns, which is, you know, lately, let's say in the last 3 to 5 years, I think we have witnessing more awareness, especially after COVID. Public awareness campaigns are essential to change societal attitudes and reduce stigma surrounding disability. These campaigns should highlight the potential and capabilities of persons with disabilities, promoting a culture of acceptance and inclusion. Another recommendation related to infrastructure and resources. Learning environment requires significant investment in infrastructure and technology, because as we know, educational facilities needs to be physically accessible to all students. This means ensuring ramps, elevators, and accessible classrooms are available and incorporating universal design principles in the construction and renovation of schools. Another point here, assistive technology must be integrating into classroom to support the learning and development of students with disabilities. Of course, these technologies can range from screen readers and text-to-speech software to adaptive learning platforms and communication devices. Monitoring and evaluation framework is also important to track the progress and impact of inclusive education policies. We found this really even with some of the initiatives that progressing well, especially the one led by parents and communities, are progressing well, but during our data collection, we found there is lack of monitoring and evaluation to look at the impact. This framework should collect data on student outcomes, teacher training, and the accessibility of educational facilities. Data-driven insights will allow us to identify areas for improvement and ensure that our efforts are showing tangible results, because, implementing these best practices, we need to know what is working, what's not working, and learn from these programs and initiatives. Final and additional, we call it additional recommendations. In addition to the core recommendations that we proposed based on the 3 Rs, we propose several additional measures to strengthen the foundation for inclusive education in Qatar. An urgent need for comprehensive and detailed data collection on disability issues. Currently, data on the number of children, for example, and the adults with disabilities, their specific needs and the type of support they require is limited. And we found this at the beginning of, looking at, even with the policy, with the document analysis, we know that there are documents, but accessibility to these is not available, or it's not published, because without accurate data, effective planning and resources allocation are impossible. The development of comprehensive disability portal as a one suggestion would be valuable resources. This portal could centralize information about available services, support network, assistive technologies, and relevant policies. It will serve as a one-stop platform for persons with disabilities, their families, and stakeholders. Third, we must prioritize the establishment and strengthening of family support networks. As many stakeholders emphasize, families play a crucial role in the lives of individuals with disabilities. Formal support networks can provide families with the information, resources, and most importantly, emotional support they need to navigate the challenges of raising a child with disability. This support could include parent training programs, counseling services, and peer-to-peer support groups. As a conclusion, this research report shows or underscores the progress of Qatar. Yes, Qatar has made in recognizing and supporting people with disabilities. However, it also highlights the urgent need for further action to ensure that inclusion becomes a reality for all and for everyone. Just to conclude, greater awareness about disability and the diverse needs of individuals, comprehensive data collection, and the development of support system, including a disability portal and family support networks, are important steps towards achieving this goal. Creating an inclusive society requires a collective effort. We urge all stakeholders, including government agencies, private, institutional, families, and individuals with disabilities, to work together. And to be honest, in all our data, either in interviews and the roundtable we organized and the reflective session at WISE, we always have people with different disabilities that they want to show up and to share their voice, and to share their experience and to be part of the solution. By investing in inclusive education, we are investing in a brighter future for all, fostering a society where everyone can contribute and thrive. Thank you again for allowing me to share the finding. The last slide is the barcode to download the report. We have it in both languages, in English and Arabic. Again, I really summarized it really quickly, but happy to answer any question.
Thank you so much, Asmaa. That was really super informative presentation, very thoughtful presentation. And my first question was to actually how we can access this report. And it's great you are sharing this QR code that can be used by our participants now, as well as those who will watch this webinar later to access the report. I would like to encourage participants to share some of their questions or indicate they want to speak. We have one question already, but before we ask that question, I just wanted to start by asking if you could tell us a little bit more on how data collection on disability works, because I suppose that must be quite challenging on physical disabilities as well as less apparent disabilities. How does it work? And second question, also quite basic but very important, I think, is does the government funding for schools, how does government funding for schools work for Qatar? Is it per student funding or some other? So does it account for the proportion of disabled students? Because obviously taking care of disabled students, providing individual tailored educational opportunities would cost much more than students who do not have disabilities. So if you could tell us about data and funding, it will be really helpful.
Sure. Thank you, Maya, for these really important questions. They are not simple questions. Sometimes we need to go to the basic and simple questions to solve such complicated situations. So for data collection, as I said, this is, for me as a researcher, this is my third research project focusing here in Qatar, but I've been, supporting, and as a director of research at WISE, we have been doing research on such different aspect of inclusive education. So what we found, number one, accessibility to documents, to policies was really a challenge. As I said, Qatar is small, but finding these published, approved documents is not always available. That's why we thought, let's engage people at different stages. So that was number one. When we designed it to have a roadmap, it's also related to the research questions. The way we designed it, we want to hear from people on the ground. We want to hear from people in universities. We want to hear from people with disabilities, including parents and community. So that was really helpful and gave us really opportunity to do data collection. The roundtable, I think, was really important. Once we did the literature review, we want to have a framework that will allow us to build our interview questions and so on. And to be honest, there was a learning part of it, learning process for us. Okay, what did we learn from that phase and how this will inform the next phase? Almost 50 to 60 people came to the roundtable from all different stakeholders, even students, people with disabilities, parents, policymakers. And during this these phases, we also worked with the Ministry of Education and Ministry of Social Family and Social Development. Either we work with the minister herself or with her team. Because at the end, we want to support this organization for the implementation. So that was for the round table. Then we did the interviews. It was mainly online, you know, through digital platforms, Zoom and Teams. People were really responsive, and they want to share, but everyone gives different perspective. يعني it was really interesting to hear, for example, even the definition of inclusion varies from, you know, educators to researchers and so on. Then the last one, which we did it first time, is the interactive session at WISE. And instead of us, you know, presenting the report, the final report, we thought, okay, let's share this in a workshop format. And, you know, all of these, I think, helped us to be innovative in our research design and in our data collection. So that was for the data collection. I hope I answered that part. The funding, to be honest, so Qatar is a small, you know, public schools, almost 300 in total. Private schools, the latest report, almost 400 schools. So we have private schools more than public. This is the first aspect. Within each, we have specialized schools. So within Qatar Foundation, we have Rinad Academy for autistic children. Again, we need schools accessible for all. Fees are really high. You know, it needs specialized staff to work on these schools. We also have another school called Al-Awsaj. Al-Awsaj for learning disabilities. So for people who are not, you know, in traditional way of setting and so on. So they have Al-Awsaj school.
Okay.
In the public, if you look at inclusive education in the last 5 years, different than 10 years, they are going through different phases from trying and learning. That's why we proposed data-driven policies. They have specialized schools for different different disabilities. We have schools for blind and deaf. Again, Qatar is small. The latest policy in terms of financial and funding, the government provides a voucher for parents as to support them in their education, because it's very expensive. And we have many initiatives and programs led by community and parents, especially parents with who have families who have kids with different disabilities.
Thank you, Asma. Thank you so much. So basically, schools are, it's not inclusive education model. So disabled children will be in separate schools, from what I understand.
So, as I said, they tried to do different models.
Okay.
Different models. They included them in mainstreaming, then they separated them. Then
Okay.
okay, for social, so it varies, but it depends. So for Rinad Academy, it's only for autistic. It needs a different So it
So it's a
depends on the
mixture. In
disability.
some places, it's in
Exactly.
mainstream schools. Okay, and there are
Yeah.
also separate. Thank you so much. That's very
Yeah.
clear. That's really helpful. Can I invite Iran Ma, please, to ask your question? And then I will go back to Ahmad Akat's question, who shared it but left. Hi, Iran. Come in.
Hello, Professor. Thank you very
Sure.
much. And thank you for Dr. Al-Fadala for your fascinating sharing. And my question is about if you would like to share more about the merits and demerits of the ethical considerations of the concept disability in the epistemology of Qatar. In some indigenous African communities, there are no concepts of the physical or mental disability, but based on the moral ability. So if the categorization of disability might be a double-edged sword that may cause the empowerment and oppression simultaneously. Thank you very much.
Yeah, Maya, sorry, can you? Yeah.
So that question is also in the chat, Asma, if you want to have a look.
Sure. So talking about the context of Qatar, right? Sorry, your voice was not clear.
I can read it if you want. So Iran is asking if you could share the merits and demerits of the ethical considerations about the concept of disability in the context of Qatar, because Iran says in some indigenous African communities, there are no concepts of physical or mental disability, but this is all based on moral abilities. That's right, Iran. So there are concepts of moral
Yes.
ability, but not physical. If the categorization of disability might be a double-edged sword, causing empowerment and oppression simultaneously. So are you asking Asma about use of this word and what is used in Arabic in Qatar? Are you asking about that?
Yes, thank you.
Thank you. So tell us, Asma, what is the concept in Arabic and what does it mean? And
The disability.
yes.
Yeah. You mean I say it in Arabic?
So what does disability mean in Arabic? So what are the merits of using that word, however you say it in Arabic, because obviously people speak Arabic, right? And what are the merits of using that concept? Are there maybe some alternative concepts as well? What are the problems with that concept still? Because you mentioned also stigma, I remember from the presentation.
Yeah, in fact, no, thank you for this question. In fact, in the report 2017 we did with Nedi, we discussed the using the meaning, and even in our interview questions, sometimes they use disability, sometimes they use inclusivity or special needs, and it varies from region to another region. Here in Qatar, I remember in the interviews we shifted. Even we had people, and we conducted the interviews in English, but with Arabic speakers we tried to say it in Arabic, because Qatar, I think last year or the year before, they announced that we need to shift from special needs الاحتياجات الخاصة into disabilities. So using the term, I think it has some sensitivity, and we followed that structure. But again, ethics and stigma came as part of our data findings, especially from parents, or even people with disabilities. I remember one lady, she used the wheelchair, and she mentioned that when people ask, talking about empathy, and people always ask her for help, she found this is really not always welcome, welcome, if I may allow. So there are sensitivity, there are some ethical, and that's what we want to raise as part of this, because we are targeting public in dealing with all these disabilities. I remember from previous work, working with autistic children. Now in Qatar, they provide spaces like in the airport, even in big grocery stores, big malls, more spaces for people, for kids who can't deal with, noise, or they feel frustrated from people around them. And this came as a practice, a learning from the World Cup, where Qatar hosted the World Cup, but in some of the stadiums provided accessibility. In fact, this was one of my colleague a project um, to test this as a model and providing spaces for and I think it's related to the stigma, when other, public see these spaces. Yes, these are population who needs specific spaces. We also have part of the Ministry of Transportation and Technology. We have an office. Their role is accessibility for all, even websites, and so on. So in their office, they have like a section where they help parents to bring their kids to be familiar with flights. Even, the sound of seat belt and closing the table in the airplane, these are not okay for for everyone and for all autistic children. So these are some initiatives are helping and best practices that are helping and providing accessibility. I hope I answered your question. I don't think I got it right, but these are really the data that shows that we need a lot of work, especially giving the complexity of this agenda. Again, the idea is not to have you know vision and the strategy, but also what are the mechanisms that will allow people at different people like, schools, families, universities. Still, until now, kids graduate from grade 12, their certificate or their report don't allow them to go to university. Some of the, we have quota, we have, they have to have 2% from, employment, 2% of employment from people with disabilities. And some, they said it's only for ticking the box, because these are not the type of jobs that help them to thrive, or to, it's just, okay, we have 2% for people with disabilities. So as I said, it's very complex, but hopefully with research, and the power of research will allow us to work, and commitment from
Yes.
ministries and different entities that are taking this agenda seriously, because the impact, for inclusive society, it's the benefits for all.
Thank you so much, Asma. And we can take the final question from Alison, please, if you want to come in.
Hello, how are you, Maya? Hi, Asma. Thank you so much. I was sorry, I was a little bit late to the presentation because of some commitments at work, but really interesting, and I look forward to hearing the recording. I just, I really appreciate what you said about the data being important and actually really hard to collect, and the idea that getting data from parents being really important, particularly for students with disabilities. I wondered, so in Australia, we have a lot of students with disabilities, mostly in mainstream, but we do also have a mixed system. So there are some schools, depending on the level of disability. One big thing for our policy was making actually a definition of what is a disability and what isn't, and it's really, really extensive. So I wonder if that is something that you're also working on in the Qatar space, whether those definitions are evolving. But also, as a former teacher, I was trained quite specifically based on those definitions about how to teach students with different levels of disability within my class. And then we also had trained teachers within our mainstream school that would help teachers to modify lessons based on students. So, for example, I had a blind student in my science high school class when she was 11, and she had a support teacher with her who used to change my worksheets into Braille. She had a Braille machine, and she did science experiments like lighting a Bunsen burner, and I modified my classes so she could access the curriculum. There was quite a lot because she was quite high level from the teachers. There was some teachers that were quite afraid. And so I just wondered, in terms of your plan, is training for teachers part of that? Is that mainstream, or is it specialized teachers that you'll be training? Thank you.
Thank you for this question, and thank you for joining us. One point I didn't mention about students, are they in private and inclusive schools, or are they in mainstream or specialized schools? We have a center within the Ministry of Education. They do the assessment, and based on the child assessment, and it has two parts. In fact, last week they joined our launch. So they have medical and someone from education to give the report about the status of child. Then they advise which school. That's for where they go and accessibility. But again, waiting list is an issue. Limited spaces is a big thing here. Population, 2.5 million. We have resources for Qatari, and some other families, they don't have these resources. But again, with Qatari family, they still, I know a friend of mine, she sent her child abroad for a boarding school, because we don't have the specialty here. In terms of teacher training, yes, they provide, but for specialized, like blind or deaf, they have a blind and deaf school. But again, I think I'm not sure about this information, but for deaf, I don't think so. Blind, I think we have better situation where they finish school and go university. But for deaf, I don't think, I'm not sure, but still, it depends on the disability itself. And it's not only a teacher, they need therapist, they need assistant, they need counselor, they need to train parents, and so on. So it's not only to train the teacher. A great example that you shared, depends, you will change the worksheet for a blind child and so on. But some cases are even complicated. But again, there are, innovation and best practices and technology that allow us to support parents. As I said earlier, this is only, I consider this as a phase one. Hopefully, with phase two, where we look at, this suggestion came, from another researcher, that we look at maybe 5 or 6 models that have impact, and we look at the scaling up model. How can we scale up these successful stories, especially with funding and so on.
Yeah, thank you. That's really interesting. And I think that there is a benefit of being a small country, but there are also challenges that come with that in terms of scaling up, obviously. And yeah, as somebody also, I was a learning and support community like coordinator. So I had to coordinate and help parents and students with disability within the school context. And that idea of having a community that helps the kid and everyone's on board, it takes a lot of work making sure that you have the right people. Thank you very much, and good luck with your research and particularly the data collection. Yeah.
Thank you.
Thank you very much. So as we came to the conclusion, I would like to thank Asmaa for this very thoughtful presentation about this sensitive topic. It's great to see that there is political will to make changes and to provide best environments for people with disabilities in Qatar, and we will follow up. We will see how things progress. It's really interesting, and I'll closely follow, although this is not my area of immediate research. Really important topic that you are doing with colleagues. Thank you so much for finding time to talk to us today. I would like to remind everyone that you can access the recordings on the department's YouTube page, and this will be posted in due course. And our next seminar, we will not have a seminar in January, but we will meet again in February, on the 19th of February, where Professor Chris Glass from Boston College will talk about technologies of agency, student mobility in era of digital internationalization. Thank you, everyone, and hope to see you in February. Bye-bye.